Okay, I'm Mike Flory, and this is my patient SP, and this is our part 2 of the physical assessment. We ended the last part of the assessment with range of motion of the upper extremities, and now we're going to do some of the same exercises against resistance. Okay, I'm going to hold your elbow in place, and if you could flex this elbow against the resistance of my hand, very good, and hold it up, and extend you against the resistance, very good, and the other arm, very good, extend, very good. Okay, and now put your elbows on your thighs with your palms up. Okay, flex your wrist against my resistance. Very good. Now pull it flexed and extend. Okay, very good. And this side. Okay, and extend. Very good. Okay. And now I'd like you to squeeze both of my fingers with each hand. Okay, very good. At this point in the exam, we're going to have you lay down on the pillow so you're at about a 30-degree angle. Okay, and I'm now inspecting the neck. If you could please look at the wall. At the wall. Look at, turn your head to the side. The other side. All the way. Okay, and now the other side. Okay. Now we're going to inspect the chest. First visually, looking for any pulses or heaves. Now I'm going to palpate the chest. I know if I feel any tenderness. I'm also looking for pulses and heaves here, and I'm also going to palpate for the apical pulse. Okay. Now I'm going to listen to the apical pulse. I'm now going to continue to listen to the other heart sounds. Okay. Now if you can roll on your left side. At this point, I would listen to the other heart sounds with the bell stethoscope to listen for abnormal heart sounds. I'm just going to listen to the apical pulse on his side with the bell of the stethoscope. Okay, at this point you can roll back. And if you can sit up slightly, I'm going to remove the pillow so you're lying flat. Okay, now we're going to assess the abdomen, first visually. Now we're going to listen to vowel sounds in all four quadrants. Okay, I'm also going to listen to the aorta and renal arteries. Okay. Now I'm going to percuss the abdomen in a zigzag pattern. Okay, now we're going to do some light palpation in the abdomen. Let me know if you feel any tenderness or pain. Okay. Now we're going to do some range of motion with your hip. If you take one of your legs and raise it to 90 degrees, as best you can, and lower it now. And with the other leg. Okay, very good. Now you can bend one of your knees. Rotate your hip inward. Very good. And outward. Very good. Put that down. And with the other knee, do these same things. Very good. Okay, now if you could separate your legs and close them. Okay, I'm now going to have you lift this leg versus resistance. Okay, and lift this leg versus, okay. And now try to open your legs versus resistance. Very good. Okay, I'm now going to skip the inguinal inspection for your privacy, and I'm going to carry on with the inspection with the assessment of the lower extremities. First, doing visual inspection for skin integrity and hair distribution. And now I'm going to palpate for the pedal pulse, and then I'm going to follow that up with the tibial pulse and the pedal pulse. The first one is popliteal, I'm sorry. And now the pedal. And I'm going to repeat that on the other side. Okay, now I'm going to palpate the legs for edema. Check for temperature. Capillary refill bilaterally. Okay. Now I'm going to have you do some range of motion with your ankles. If you could point your toes to me. And flex your feet towards your shins as best you can. Okay, and back to normal position. Roll your ankles in. And now roll them out. Okay, and curl your toes. And separate your toes. Okay, and I'm inspecting the in between the toes while I'm here. Very good. Okay. And now I'm going to have you flex your feet towards you against pressure. Okay. And I'm going to have you push against pressure. Okay. And now roll them in against pressure. Okay. And roll them out against pressure. Okay. Okay. At this point in the exam, I'm going to have you sit back up. And lean off the side of the bed. You can extend one leg at a time out to about 90 degrees, or best you can. Good. Good. And now we're going to do the same thing against resistance. Okay. Okay. Now I'm going to have you do a few things with your eyes closed. For reference, I'll throw your palm. You can actually open your eyes for this part. This is going to be dull, and this is going to be soft. Or sharp, I'm sorry. This is going to be sharp. Okay, and now close your eyes. I'm going to touch parts of your body, and you're going to tell me if it's dull or if it's sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, now with your keep your eyes closed, I'm going to put an object in your right hand. If you put your right palm out, you're going to just feel it with that one hand and tell me what that is.
A U.S. quarter.
Okay, and I'm going to do the same thing with the other hand and a different object.
A pencil.
Yep. Okay, and now I'm going to do a series of light touches, and you're just going to tell me where it is on your body that I'm touching you.
Right foot. left arm, right cheek, right hand, left leg,
Okay, very good. You can open your eyes now. Since I don't have a hammer to do the deep tender reflexes, I'm just going to use the myself. If you could let your leg go a little limp. Okay. And if you can just put your palms on your thighs, close your eyes one more time. I'm going to move a digit, and you tell me which digit and whether it's going up or down.
down, middle finger down, middle finger up, middle finger up,
Okay, and now you can open your eyes. And I want you to just do as I do. Flip-flop your hands like this. And go faster. Okay, very good. All right, now I'm going to have you stand up. And you can stand over here. Take a few steps across the room towards the camera. Okay, and now the other direction, go heel to toe.
heel to toe,
Toe to heel, heel to toe, yeah. Heel to toe. One after the other, one front.
top,
Okay, and now take a couple steps on your toes. Okay, and now you can take a couple steps on your heels. Okay, and from where you are, just face this way and bend over at the waist. Okay, and now back up to normal position, bend side to side. Okay, and do a twisting motion to each side. Okay, very good. And I'm going to stand next to you, and I would like you to close your eyes for 20 seconds and just stand still. Okay, you can open your eyes now. Okay, I'd like you to hold on to this table for balance. And I'd like you to lift one leg at a time, raise from the knee to about 90 degrees. Okay, you can put that back down and raise the other leg to about 90 degrees. Okay. And that ends our physical assessment. Thank you very much for participating.